Nearly 7 million Americans are living with Alzheimer's, and that number is growing fast. Joining us to share how to recognize the first signs of Alzheimer's and how you can reduce your risk is California Department of Public Health physician Dr. Lucia Abascal. Welcome.
Hi, thank you for having me in this important conversation.
Now, doctor, as the number of seniors age 65 and older continues to grow, so does the number of Californians with Alzheimer's.
Yeah, so as the population grows, so does the number of people with Alzheimer, because we know that age is the biggest risk factor for Alzheimer's. By 2040, we expect that the number of people living in California with Alzheimer's will double.
And that's really why it's important to raise awareness and educate yourself. And that's also why the California Department of Public Health is launching a new campaign to promote awareness. Tell us about the Take on Alzheimer's campaign.
Yeah, so the California Department of Public Health is launching Take on Alzheimer's to raise awareness and reduce stigma surrounding the disease. Alzheimer's is currently the third leading cause of death in California, so it's more prevalent in women compared to men, and it's more likely to also affect people of color. So that's why it's super important to know the signs and symptoms so that we can start the conversations with our families if we spot any of the symptoms in ourselves or in our loved ones.
And taking on Alzheimer's also means learning to recognize the signs and symptoms that you should not ignore. Can you tell us about them?
First one people think about is memory loss, and that's a big one. The important thing is that this is a type of memory loss that affects daily life. Also, challenges in planning or solving problems, for example, a simple math problem of like how many apples I have and they cannot count correctly. Completing familiar tasks, so suddenly the person cannot put a sweater on or something super simple, tie their shoelaces. Also, confusion with time or place. Where am I? What day is it? Trouble understanding what they're seeing, either a drawing, art, or TV. Emotional things such as like changes in personality, suddenly being more withdrawn. Others include new problems with words, speaking or writing, losing things, misplacing things. There's also decreased or poor judgment, so people might take riskier behaviors. There's also a withdrawal in activities and changes in personality. This is a chronic disease. That means that it continues, but it also gets worse. So at the end of the disease, people might be completely dependent on others. So we don't want to get to that place without planning legally, medically, financially for what will happen. And that's why taking action in the first signs and symptoms is so important.
Now, while the primary risk factor for Alzheimer's is age, there are still steps we can take to reduce our risk and improve overall brain health. Tell us about them.
So Alzheimer's can be impacted positively by a healthy lifestyle. So controlling diseases such as diabetes, obesity, hypertension, keeping those at bay, getting medical treatment for those is super important because they do affect our brain health. Also keeping active before we get Alzheimer's, but also as we get Alzheimer's, and then eat healthy. What do we mean with keeping an active brain? Brain puzzles such as Sudoku, crossword puzzles, playing board games with your family, that keeps our mind active, reading, keeping up with the news, whatever you enjoy, but that is stimulating to the brain. And we know that also affects having a healthier brain.
Doctor, where can we go to learn more information?
The first thing I would recommend is talk to your healthcare providers. You can also visit takeonalz.com to learn more about ways to improve your brain health, reduce your risk of Alzheimer's, spot signs and symptoms either in yourself or your loved ones, and also access screening resources.
Doctor, we thank you so much for sharing this important message for our aging loved ones and our community.
Thank you very much for having me, and I hope this is helpful for everybody.
And we thank you for joining us on San Diego Living. We'll see you next time.